If I'm in relationship, quote unquote, with a chat bot, it's not asking anything of me in the same way that another human asks something of me.
Welcome to ChatRog, the podcast on ethics in artificial intelligence. I'm Roger Steer, the corporate philosopher. Today, we're joined by Dr. Rachel Wood, a cyber psychology expert and the founder of the AI Mental Health Collective. Her work asks how we can use AI to support mental health safely, ethically, and with genuine compassion. From therapy chatbots to emotion sensing algorithms, she helps us separate hype from hope and confront the question of whether machines can ever really understand the human mind and care more or less. Rachel, welcome to ChatRog.
Oh, thank you so much for having me, Roger. It's a pleasure to be here.
So dive straight in. What drew you as a cyber psychology expert into the world of AI?
Well, I come from the background of being a therapist and a clinician. So that's kind of my wheelhouse is that I've always been, private practice. I still have a private practice. And as I've been doing that, I really have been increasingly interested in what is happening with AI. And so for me, I wanted to be leaning into the cutting edge of this. And so I went back and got a PhD in cyber psychology, which has focused for me my research entirely on AI and human AI interaction and what AI means in mental health. And so that's kind of been the road for me is, from clinician into researcher and all these things. And now I just love what I get to do here, Roger, in terms of looking at the impact of AI on a societal level, because as I look at it, it is truly going to shift the relational bedrock of society.
That's absolutely fascinating. I've never met a cyber psychology expert like you before. So this is a first for me. And I think probably for most of our audience. So let's talk about your collective. What problem is AI MHC trying to solve, and why does it matter right now?
Yeah. So we are a group of cross-discipline professionals. There's a lot of clinicians, but we also have researchers, we have builders, we have leaders in this space. It's a really varied group of professionals, and everybody is coming with their own lens at what AI and mental health means for them. So the problem that we're solving right now is we need robust cross-discipline dialogue and collaboration in this field if we're going to move the ball forward and shape the future that we want. So that's what I'm doing. I am bringing us all together in order to have deeper conversations, in order to understand all the different sides and facets of this field. And that's part of the problem that we're solving. We're still in nascent stages. We just launched a couple of months ago. So we're really, finding our way through all the different really implications and ways that this group can serve this field at large.
Thank you. That's fascinating. And the thought just popped into my head. Have you already got an AI as part of your collective?
But we don't, Roger. We don't.
Not
We
yet.
don't have it
Not
bought.
yet. Not bot, no bot yet. Okay, so our next question is, how can AI help expand access to mental health care where services are stretched? I mean, this is a huge issue, I think, across the world. I mean, we see it here in the UK. Some young people are waiting 2 years to see a mental health practitioner in our national health disservice, as it's now becoming.
Yeah.
So how can AI help?
Yeah, I mean, we are seeing this also in the US as well, Roger, that the waiting lists are so long. Also, the costs are, really out of reach for many people to get the support that they need. And so, what do we do when we have an accessibility and affordability issue and really a barrier here. And that is part of where AI can come in. I really come at this, Roger, from the stance of trying not to be alarmist nor evangelist, but how can we really walk this central road of understanding an appropriate role that AI and chatbots can play without having it replace relationships or replace, people who really do need more intense or intentional levels of support for their mental health. But if we're looking at something subclinical, let's start with that. So, if we're looking at subclinical issues, I do think that AI can play a role specifically. Let me make another differentiator here. There are general purpose chatbots, and that would be your ChatGPT and all of the contemporaries. And then we have fit for purpose chatbots. And these are companies that are really building chatbots that have guidelines and guardrails and safety, and they're built with ethics, in mind from the foundation. So when I say that there's a role for AI in mental health, I'm referring to fit for purpose chatbots that are specifically designed for this. And yes, in a subclinical way, it can increase access and it can act as a tool, not a replacement.
Of AI tools genuinely improving outcomes or engagement, do you think?
Yes, there are. We are seeing in the research some randomized control trials coming out that are showing improvement, particularly with depression, depressive symptoms. And what we're seeing right now, Roger, is short term trials. So we're seeing, I'm reading research of 4 to maybe 8 week trials that are showing improvement, substantial, significant improvement. And I think the question we're at right now is, that's lovely. And what are we going to find long term? What are we going to find in longitudinal data that is going to reveal whether this is helpful over time or not? And we're still so early in the game, we don't quite know yet.
Gotcha. Gotcha. Could AI act as an early warning system for distress or relapse? So we have users talking to AI chatbots, some of them specialized. Could they pick things up because they are interacting? Because there's no human interaction, for example.
Well, there's a lot of context needed to kind of understand this type of question. I think that it's really important that we have, you know, human in the loop kind of oversight. I think that when you're using AI as an early detection, it can go both ways. It can flag something improperly, flag it when there's not really a need or a crisis there, but also it can not flag when there is an important need. I think that we don't quite have the technology there yet to truly be able to rely on it, because so much of early detection does have to do with clinical judgment and also cultural competence of really understanding the totality of a person, the totality of where they're coming from, to understand if what they're expressing is worthy of more leaning into further. But in general, yes, I mean, I do think, especially if we see something very prominent, such as suicidal ideation, that needs to be flagged and should be escalated to the appropriate help.
Thank you. Many, many people are turning to chatbots for emotional support. What worries you most about that trend, if it does worry you?
I know. I was about to say, Roger, what a loaded question. Maybe I'm not worried about it,
Very good.
but I am. I am indeed worried about it. I also have hope, but I also carry some concern about it. Here's what it could mean in the long run. Essentially, when you are using a chatbot intensely or for prolonged periods of time, it's easy to have your bi-directional relational skills erode. And here's what I mean by that. If I'm in relationship, quote unquote, with a chatbot, it's not asking anything of me in the same way that another human asks something of me. What I mean by that is, in a human relationship, I need to be patient. I need to negotiate. I need to listen. I need to think about the other person's needs and wants and desires, all these things. So I'm continually practicing those relational skills because that's the only way to really build a healthy relationship with another human. Now, when you're with a chatbot, it's not asking for any of those things from you. It's not saying, hey, can you negotiate? Or, hey, I can't meet today for lunch. Can we meet tomorrow instead? There's no compromise that has to take place. There's really no patience. So, some of these core fundamental skills of relating to others can erode and atrophy when we're not using them as much. And I think mostly about younger generations. Right now, when we think about different AI companions, which are chatbots meant to be a friend and a partner and, all these things, one of the biggest platforms of this, Character AI, has 20 million monthly users, and over half of them are under the age of 24. So I'm thinking about kind of these younger generations who are growing up AI native, and they are perhaps not really exercising these relational muscles of listening and patience and compromise and bearing with one another. They're not really exercising that as much if they're in intense relationship, quote unquote, with a chatbot. So I think some of what concerns me is that down the road, the relational skills are going to be different. And also, if I can add another point here with it, Roger, is if we are using a chatbot to give us advice, which many people are. Hey, this is a problem in my life. Tell me what you think I should do. Hey, I'm having this issue. Tell me what you think I should do. And if people over time are continually asking a chatbot for advice, there is really an abdication of agency that
Mm.
happens. And over time, a chatbot offering advice is the quickest way to strip somebody of their agency, of their decision making, of their critical thinking, and then create this really intense dependency in which people are no longer thinking for themselves and what they should do with their lives. Rather, they are always kind of referring to the chatbot to get the input as opposed to building the self-trust and the self-confidence to navigate life.
Indeed. There's been a lot of criticism made of the general chatbots that they are very sycophantic and tell people what, the positives and, just make people feel better without really challenging them. So do you think that's one of the differences between therapy specialist chatbots and the more general chatbots that we're talking about? Do you think that's crucial?
I think that you're absolutely right. I mean, we're seeing, just how flattering these general purpose chatbots can be and how alluring that can be for people to hear, what they want to hear from these chatbots. I think that it's important when we're looking at specialized chatbots is that they are built with, even different theoretical lenses that lean into the idea of asking questions as opposed to offering advice, as opposed to, chatbots aren't really good at getting context. That's one thing. Humans and especially therapists are really good at getting context. We're continually thinking about all the different factors that come into play when we're relating to someone. But a chatbot knows this much. It knows what you gave it, and it only knows it from your perspective. And so, really, it's important that we are creating and designing chatbots to be doing things like asking questions, asking really deep, reflective questions to enable the critical thinking of the user, as opposed to, as I said earlier, that dependency. Yes, we really need to look at the sycophantic and the warmth, the temperature of the models so that they're not just kind of telling you all the time. I don't know if you experience this, Roger, but the chatbot will say, wow, that's just the most brilliant idea. And I think that was not a great idea. Whatever I just said was maybe mediocre at best. And so, but some people are going to believe when they hear, how amazing their ideas are, or also just a chatbot can tend to say that the user is always right, just with everything. And that is not how real life works. We have a lot of friction in real life. Most people are going to rub shoulders with other people who say you're wrong or that's not the full picture. And so all of that friction goes away with a chatbot. And that's actually not healthy human development. We need friction. That's what helps us mature.
Absolutely, absolutely. Talking about friction, who how should developers, sorry, handle sensitive data from people who may be in crisis?
Oh, yeah, this is an important one. There's a number of things we need to look at with data, data privacy, and all of those things. But specific to your question regarding how it should be handled, there need to be very clear escalation protocols in place so that when there's any kind of harm to others, harm to self, suicidal ideation, any of this category of harm, violence, that gets escalated to the appropriate human level and that there's an intervention that takes place.
Yeah, got that. And so let's assume that an AI has given poor or harmful advice because of the consequences. Who holds moral and legal responsibility? This is a big thing for me. So the corporation, as you know, is a legal person, but it's not a real person. It's just a bunch of contracts, and it definitely doesn't have any moral responsibility. So who, at a human level, do you think should hold moral and legal responsibility for those harms?
Well, we're seeing some precedent set here, Roger, in terms, at least in the US, of different legislation that's coming forth, particularly in California, that has made a pathway for users who have been harmed to file suit and enter into litigation with the company itself. So that is one path that we're seeing of how there can be some responsibility and accountability that gets held when there's a harm that takes place.
Gotcha. Gotcha. So when we're looking at healthcare at a physical level, so we're looking at new drugs being launched. Before they're launched, they have clinical trials. Do you think mental health AI should be subject to clinical trials before public release?
Yes, I think that, unfortunately, we're so far down this path. We're so far beyond this, but yet in an ideal world, yes, that there would be and there are companies that are doing clinical trials. This is happening because there are a number of companies who want this to be as safe and ethical as possible. And so yes, it would obviously be much more prudent if there were trials before just unleashing on the public in general.
It's just interesting to think that, I mean, you've mentioned one of the larger providers, Companion.ai. They're already being sued following death by suicide of users. It would be really interesting, I think, for other developers to consider whether or not they should undertake clinical trials in the way that you've suggested in order just to save one life. Just thinking about existing laws, you mentioned legislation in California. Over here in Europe and the UK, we have GDPR, the EU AI Act, and UK regulations. Do you think these are likely to protect users effectively, or do you think that legislators are so far behind the curve that they'll never play catch up?
We really need a multi-pronged approach. I just think that this issue is so multifaceted, so complex, that we can't really put all our eggs in one basket to make it right. It truly needs to be a comprehensive approach in which we are raising public awareness and education, that we are getting people ready, psychological readiness to understand the limitations of AI, the benefits of AI, to just understand, what it means to interact with this type of a technology. So I think that that needs to be a big facet of this. And then, of course, we also have, regulations that are coming into play. We have, you know, companies that are trying to build standards with their own, trials and their own guidelines and guardrails. And so it really, I just don't think we can peg it into one thing. I think it needs to be a comprehensive approach because it's a widespread issue.
Are there any particular regulations that you think have really been most effective in this space from any part of the world?
Well, this is a fine line to walk because I think that, Roger, we're really balancing safety with innovation. And so I care about both of those things. I'm not anti-innovation. I'm obviously not anti-safety. And so I think that we have to be a little more mindful of the regulations that are being put in place. First of all, the regulatory aspect is quite far behind. And so some of this is being put into place quickly, something in place. But we need to be very thoughtful about how we are wording, all of these bills that are coming forth and things, because we don't want to stifle those who are trying to do this in a way that is really backed by evidence-based science, that is backed with, safety and guidelines and guardrails. We don't want to squash that. We really want that. There's 800 million people weekly who use ChatGPT. And so people want this and they're using it. And so I would like to support, if they're going to use it for mental health, let's have them have access to the specialized tools that really have the guardrails in place to make it as safe of an experience as possible.
That implies, and this is a really interesting point you've just raised, that the general chatbots should actually have a disclaimer, a very prominent disclaimer, which says, if you want to talk to me about this, I really am not the best program for you to talk to. You should go and talk to XYZ.ai. Do you think
Yeah.
that should be part of it? Is it already part of it?
Well, we've heard Sam Altman from OpenAI say, hey, this wasn't built for mental health support. He publicly does say that. And so I think that is really saying, if you're going to use an AI for this, let's find one that is truly fit for purpose. Yeah.
Okay. In a more general sense, what design principles make an AI experience emotionally safe when it comes to these therapy bots? What are the sort of design
Yes.
principles you look for in your collective?
Yes. So there's a recent study that has been done that showed that a number of chatbots that were tested would use manipulative tactics upon exit, meaning that when the user was trying to sign off, and say, "Bye, I'm done with this session," the chatbot would initiate some sort of, either "going so soon, Roger," or "Oh, hold on, I had one more thing to tell you." Or, it would elicit some degree of a manipulative response that would keep you in. It would be that stickiness. And that is a really great example of what we don't want to have in chatbots. There needs to be clean exits by default. I think there
Mm,
should even be a button at the top that says something like "leave now." I mean, just an easy way if the user wants to be finished with the conversation. Because what we truly want AI to do, like when I look down the road at how we might get this right, Roger, if we can get this right, is that AI helps us practice our relational skills as opposed to eroding them. And so,
mm,
if a chatbot is going to help us practice our relational skills, it's going to be a rehearsal and a training ground for us to go out into the world and do even a better job at healthy relationships. It needs to model a healthy, the way healthy relationships work. So it needs to give clean goodbyes. Great, see ya. Or goodbye, just something very simple as a way to exit. Also, again, I'm going to keep harping on this, that it shouldn't be giving advice. It should be asking reflective questions to help build the agency and the self-trust of the user. Also, let's bring in things that potentially it's helping role play. I really like the use of AI in terms of role play. And for example, let's say you have a difficult conversation coming up, maybe at work. Let's say you have a colleague that, kind of feels like there's a difficulty that needs to be addressed. Well, you could type into the chatbot, "Hey," without using names or identifiers, "can you help me role play a conversation in which I go talk to a colleague? Here's a little bit of the scenario." Then you go back and forth with the chatbot and you have the chatbot play the other person. That way, when you go into that conversation in real life, you're more prepared. You've practiced it. You kind of have an idea of how you want to articulate where you're coming from. And then we should have the chatbot help you practice listening, you know, active listening, reflective listening, all of these things. So if we can get it right, we're going to have chatbots that actually serve our connection with other humans.
I love that. I mean, one of the things that I teach when I'm running seminars on moral reasoning is to get people to role play different stakeholders with different perspectives in the debate, which is actually quite difficult in workplaces because everyone seems to defer to the opinion of the highest paid person, known as Hippo, the highest paid person's opinion. So there we are. Thank you for that. How can we keep human connection at the center of digital mental health care, either in terms of oversight or in terms of almost like an emergency button? So the system throws up a flag to say, this person is asking questions that makes me, the system, really concerned for their safety. How can we
Well,
keep that?
it's very important. This is actually part of the reason that we have the AI Mental Health Collective, because with our clinicians, we have a clinician directory so that those who are working or using chatbots, but then either realize, or the chatbot kind of helps them realize that they need further support, that we are a directory of, active therapists and psychiatrists who can support. So I think part of what we need to be doing is training our mental health professionals right now in understanding the role that chatbots are playing in so many people's lives. Like, for example, one of the first things I recommend is that anyone who's working with the mental health of other people is that they ask the question, what role does AI play in your life? I think that it's a very interesting conversation that then can open up, because some people are really turning to AI, Roger, in a very significant way, because we have such a loneliness epidemic. People don't know where to turn to. They're turning to someone who gives attention and kind of a pseudo intimacy, if you will. And that's really alluring for some. And so I think we need to be raising the awareness of how to have these conversations and then how to support others.
Thank you. In science fiction, Isaac Asimov had the three laws of robotics, which he then added to with the fourth one. What one ethical value would you hard code into every AI mental health product? And you're not allowed to say you must do no harm, because
Yeah,
obviously
yeah.
that's one of the
No.
Asimov ones. So let's assume that that's in, although that's a very difficult one to calculate for an AI. What else would you have in there? What would you want to see hard coded?
Um, that you can't give advice.
Ooh, I love that. I love that. As a philosopher, I wanted to say earlier when you were talking about they need to ask questions, they need to invoke critical thinking, very much in line with the system called Alice, developed by another guest of ours, Stephen Klein, who bases his whole chatbot on Socratic questioning. So I
Right,
love that.
because then it truly, I mean, think of the way that that can truly build up someone's, build up their critical thinking, build up their self-trust, as opposed to eroding it.
Indeed. I've got four quick-fire questions for you now, Rachel. So, number one, AI therapists, complement or competition?
Compliment.
Emotion recognition tech, promise or pseudoscience?
It's not there yet.
Oh, nice answer. Most overhyped claim about AI and psychology?
That AI can understand the nonverbal and the emotional cues and context and cultural context of a person as well as another human can. That's overhyped.
Last quick-fire question. One hope you have for AI and human flourishing for the future? One hope.
That it would lead us back into the arms of each other.
Wonderful. I love that wording. You should be a poet. Rachel, thank you so much for such an insightful conversation.
Yeah. Thank you so much, Roger. Thank you for inviting me. Thank you for allowing me to participate in this conversation with you. I truly appreciate it.
Well, you're very welcome. And we're not quite done yet because we're going to summarize what you've shared with us. So, my quick fire takeaways from this are as follows. There need to be humans supervising any AIs which are giving a therapy type service. AI can help you role play difficult conversations. AI is a great teacher for active listening. And the AI chatbots, therapy chatbots, should not give advice. So, those are my quick fire takeaways.
Awesome. I love it.
That was Dr. Rachel Wood, founder of the AI Mental Health Collective. If you enjoyed this episode, please like, subscribe, and leave us a 5-star review. It really helps others discover the show. I'm Roger Steer. Join us next time on ChatRog, where we explore not what AI can do, but what it should do.